Carol?
Is there anybody else in the waiting room?
I think you're good, Carol.
Yeah, everybody's in.
Thank you. Good evening and welcome everybody to Community United's event, What Does Living with COVID Mean to You? I'm Carol Jackson-Durga. I'm one of the fellow directors of Community United, and we're very pleased to welcome you all this evening. Just like to tell you a bit about a few housekeeping help us with the evening. We're here to hear from you, so we really encourage you to be interactive and to use a chat function to ask any questions. Also, you can raise your hand if you have a question to ask. This meeting is being recorded and will be available on the Community United website and social media following the event. Please can I ask you all to put yourself on mute during the event. Unless you're speaking, then you're welcome to unmute yourself. The chat box is there for you to engage, and please, we'll ask you to share as much as possible. So what we don't answer tonight, we will get back to you with a written response. As Community United is a very inclusive organisation and we welcome all, we will ask you if you would kindly keep your cameras on. However, we do respect your wish should you not wish to do so. There also will be a question and answer session during the event, and please we'll ask you to engage with that. And please feel free to ask anything that is happening. And finally, photographs. We will be taking photographs to use for social media during the course of the event to let people know what is happening. Thank you very much.
Alice?
Thank you. Good evening, everyone. Thank you, Carol. Thank you very much for joining our 6th community conversation since we started 20 months ago. For those of you who are not aware, Community United West Berkshire is an independent, not-for-profit, non-partisan and community-based organization. We focus on making a positive difference into the lives of the culturally, ethnic and migrant communities, large or small, working or living in West Berkshire. Today's community conversations about what does living with COVID mean for you. As Carol said, it's an interactive online conversation with eminent panel of speakers. We've got Professor Tracy Daszkiewicz, Director of Public Health for Reading, Wokingham and West Berkshire. We've got Dr. Abid Irfan, who's our local GP at Strawberry Hill, and who's also the Vice Chair of our West Berkshire Health and Wellbeing Board. Yeah, and the next panel speaker is Dr. Anthony Collins, who is an NHS GP with 20 years experience working in the Reading area. He has spent a year on the COVID frontline, assessing and managing patients with acute COVID symptoms. For the last 15 months, he has been part of the Berkshire Long COVID Integrated Service Clinic based at Royal Berkshire Hospital. We as directors of Community United are excited to announce that we are going to be working in partnership with the Royal Berkshire Hospital soon, to raise awareness of support available for people suffering from long COVID in Berkshire and beyond. In particular, to raise awareness among the ethnically diverse group. Around 2 in 9 of those attending the Bliss Long COVID Clinic are from the ethnic minority origin. This project is called COVID and Me, aimed to engage with communities, people with long COVID, to explore the reasons why people differ from engaging. So without further ado, I hand over to Brian, who is the facilitator for this event.
Good evening. Really good to see so many of you come along. I mean, what a journey we've all been on for the last couple of years. What it's meant to so many of us. And one of the things we want to do tonight is kind of test out where we all start from and where we all finish at the end of this particular conversation. So our technical guru Dale is, I hope, going to place a poll question on the screen any second now. There it goes. How confident are you about the guidance about living with COVID, about how you live with COVID going forward? And I'd invite you all, as will I, to give us your views on how confident you are about living with COVID in the future. And when there's a sufficient number of those in, someone on the techie side will give me a little nod and say, that's great, Brian, move on. But I'll give you a few seconds still to record your views. Have we got most people responded to the poll now? I assume they have. Yeah, I think most people have given us their views. Thank you very much for that. We'll do it again at the end, and we'll find out where you all stand with it. We come to our first speaker of the evening. Tracy Daszkiewicz, as you've heard, is the Director of Public Health for Berkshire West Council. And her real specialisation and interest is about recovery. And I suspect that a lot of you who've decided to come along tonight are interested in that very thing, because you're still feeling the effects of COVID and you want to know about recovery. I'm not sure how far Tracy's going to go into that particular subject, but certainly when we get to the questions, something I know she'll be able to pick up on. But I'll leave the floor open to Tracy now to let us see and hear her presentation.
Thanks very much, Brian. It's really lovely to be here this evening, and thank you to Alice for the kind invitation. I'm just going to give an overview really by way of just doing a little bit of insight into where we've been and probably a little bit of a look to where we are heading. So I think for all of us, we are aware we're moving into a new phase of COVID. This pandemic has come in different phases, and we have seen the increases in cases and then cases going down, and then new variants, and all the challenges that that's brought with us. They're living through the different seasons with the pandemic, the lockdowns and the various restrictions have affected us all hugely. The separation from loved ones, the fact that we haven't been able to travel globally and have been grounded really in the places in which we live, has had a massive impact in different ways on all of us. I think we are in a very difficult phase of the pandemic. We have moved to a period where there is less mandated instructions about how we live with COVID. We've seen certain restrictions be taken away, so we're no longer mandated to wear things like masks when we go out in public. We're no longer required to isolate. Testing regimes are changing. So there's all different versions of how we're doing. We're having to make decisions for ourselves about how to stay safe. However, the pandemic is still with us, and we are still seeing cases of COVID within the community, and in some communities and places, cases continue to rise. We are seeing in some parts of the country increases in people in hospital. So we know that the pandemic is still a risk to us and our families and friends. So we need to think about how we live with COVID in a sensible way now that all of the mandatory guidance is disappearing. And some of that is just about taking sensible precautions. We live with all sorts of infectious diseases in our communities, things from the common cold to the flu, to things like TB. So we live with all kinds of infections all of the time. So it's just about being aware and behaving the same as we would with any other infectious illness, and staying at home if we do feel poorly, and making sure that we take those precautions, that if we're in very, very crowded places, still wear your mask. That's absolutely fine to do so. I still wear my mask when I go to the supermarket, and I see many other people choosing to do so. It's certainly decreased. We're seeing less people with face masks in normal shopping centres. But for me, I still wear my mask when I'm out in public. So it's about what you feel safe with. I think one of the biggest questions that is coming up at the moment is those people that during the pandemic have been classed as clinically extremely vulnerable. And what does the changes mean to them? I think people have been isolated by way of protecting themselves because they are more vulnerable to having severe illness should they get COVID. So people are now worried about going out in public when people aren't wearing their masks. So what we can do is wear our own masks to protect ourselves. Obviously, the most crucial thing we can do is to be vaccinated. And we hear a lot of noise at the moment around having the booster vaccination. But if you haven't yet had vaccines 1 and 2, you can do that. It's not too late to do that. It isn't just the booster vaccines that are available to us. So to start your vaccination programme now is absolutely vital if you haven't done so already. So I think there are ways that we can start to make sure that we're protecting ourselves as we live with COVID in a new way. But because the mandatory items aren't there, doesn't mean that COVID has gone away. It is still very much with us. And then as we go forward into recovery is going to mean different things to different people. And it's odd to be talking about recovery when we are still living in the midst of the pandemic and rising infections in certain communities. But it's also important that we start to think about recovery and not just about things like the economy. We've heard a lot about economic recovery, but also about what it means to us socially and what it means to us as individuals and our communities. But we also need to think about the economy and the social aspects together. These aren't exclusive of one another, and it isn't a case of having one without the other. They are interdependent and they are not opposites. To have a fruitful economy, we need to return to good health and find a way of living with the pandemic as we go forward. The starting point for recovery is to understand the impacts of COVID, for example, where it's been and what our impacts are. We'll have all experienced the isolation that COVID has brought to us. We've seen increased anxiety within our populations. We're now seeing that anxiety about how people come back out into the community. So we're all going to be in different places. We'll have all had different losses during the pandemic and how we've experienced that, not being able to be with loved ones as they've passed away, not being able to be with loved ones that have been ill and being able to care for our loved ones in the way we normally would. All of these things are really, really difficult, and it's all going to be really hard for us to come back from. So all of these aspects need to be part of the way we heal as individuals and a community. That loss of missing and not saying goodbye is a trauma that we will need to come back from as we go forward. And that as well as the physical long-term impacts of COVID for those that are suffering from long COVID, which we're going to hear a lot about later on in the evening. What we're starting to see and what we know from people that have lived through trauma, and the pandemic has certainly left many people feeling trauma, is that we start to see the effects of that 2 to 5 years after the impact. So when we talk about recovery, this isn't necessarily going to start now. This is something that we need to be thinking about into the medium and long term as well, and to make sure that we've got services in place for you and your communities. And that's why conversations like this are so important, so we can hear about what you need to help you repair from the pandemic as we go forward. So as we plan together, these conversations are going to become all the more important. So it's great that you're with us this evening to start that conversation, to make sure that as we go forward, we're not thinking about this as a one size fits all, but making sure that we're creating a recovery space that's fit for all of us. I'll leave it there and I'll hand back to Brian. Thanks, Brian.
Thanks, Tracy. I can see one comment from Leslie who's saying it's a really good summary, highlighting the interdependence of all of the aspects of how that's key, but that interdependence is being lost in the living with COVID narrative. And I think that's an interesting one. And I kind of want to add to that, because I was really interested in what you said about masks, because it's really has become a choice now. And I have to confess, I've kind of slipped into the habit now of sometimes going into shops and things and not wearing a mask. And I sometimes feel slightly guilty about it, because I wonder, does it make other people feel uncomfortable? And actually last Saturday, I was in the supermarket doing the shopping, and this other gentleman almost bumped into me, and then he said, "Oh, I thought I recognized you." And I didn't have a mask on. He did. And I said, "Well, I wouldn't know anyway, you've got a mask on." And we had a bit of a laugh about it. but I always felt guilty because he had his mask, and did I make him feel uncomfortable? Firstly, is there an etiquette that we're growing, that we have in society about masks? And secondly, how does that interdependence work, where we need all of the various things that keep us safe working together? And how, as Leslie says, how does that interdependence relate to living with COVID?
Oh, it's a great question, a great starting point from Leslie. Like you say, it is pretty much a choice now. I mean, there is still places where they will ask, you know, I went to my GP surgery yesterday. I was made clear I needed to wear a mask while I was there. There are certain services where we are still required to wear a mask, and it's very much the venue's choice to do that. If we're in very crowded places, we often find, I went to the theatre 2 weeks ago, and you know, we still very much was asked to wear a mask in that situation, despite the fact it was a special showing and it was limited in numbers, but there were still those requirements. So you are finding services and organisations still putting that mandate in place, but it's not mandated by guidance anymore, so it's not policy. Yes. I think for me, what I'm really conscious of is the amount of people that, and it was a huge proportion of people that were classified as clinically extremely vulnerable during COVID. And for those people that are trying to rejoin and get back out, I think for them, they feel safer if people are wearing masks around them. Of course, they're not wearing a big badge to say I'm living with a long-term condition. So it's really hard to say. So I think it's personal etiquette, but I don't think we should feel guilty about the choices we make. I think, you know, it is very clearly by policy a personal choice now. And I think it really does depend on how crowded it is. You know, there's a very big difference between the numbers of people that you will find in a large supermarket on a weekday afternoon to that you would see in a football stadium. So I think it's about making sensible choices. But if you feel that you want that extra protection, absolutely continue with those messages. And that is about wearing your mask, washing your hands is still absolutely vital, maintaining a distance wherever you can, and obviously taking the vaccination.
Yeah, I see Shane saying that he was anxious today in Marks and Spencer's, and I can understand that. And actually, Shane had a question before we started tonight. There are a couple of other questions there, which I'll run through, because we've just got a little bit of time left before the next presentation. Shane, if I just tab back to it and get to the point where I can read your comment, Shane. I had to go to the shop today. I was very disappointed and not a little scared that I was the only person wearing a mask. I expect much better from Marks and Spencer's. Actually, that's a good point. I noted through the entire pandemic, there was a different level of mask wearing and distance keeping depending which supermarket you went to. Very good point, Shane. But it does make me very scared to go out at all. I could understand that, and I'm sure one of the things we need is respect between people, so that everyone feels comfortable. And someone like Shane deserves to have his concerns respected, doesn't he?
Yeah, I mean, the question is there. I mean, I would expect the staff in Marks and Spencer's to still be wearing a mask, and we're seeing that in a lot of places where the staff are wearing masks but customers aren't, which is an interesting split. It's obviously a lot harder to manage the public. You know, I think it's different, but I think where we're going into stores, and certainly a lot of stores have still got, you know, we hope you will take the choice to wear a mask. It's worded in a way that the choice is yours, but our preference is. You know, there's that sort of implied requirement. But staff very much, on the whole, are still wearing masks, and it should be the staff that we're coming in close contact with. I think as we're mobile on our feet, we can avoid people on the shop floor, but in the closer proximity of asking a member of staff a question, you know, where an item may be, for example, or at the checkout, we will become in close proximity of that person. So I think what we are seeing in stores is that mask wearing is still required by their staff. Yeah, again, it's not a policy thing, it is a thing that the management of those stores will be doing.
I'm not going to go through all of the comments because there are a number of coming in, but you can see from the comments of people in our audience tonight that people really want respect to be shown to other people, and they want to feel safe themselves, and they want to keep other people safe. And those are perhaps key things that we all need to bear in mind. Those are really important things. I think we should move on to our next presentation now. It's just coming from Abid Irfan. Now, Abid is one of our local GPs in Newbury. He's also the vice chair of the West Berks Health and Wellbeing Board. He's a CCG clinical chair, and we've said he's a frontline GP. His practice is pretty much town centre, so he's seen a lot of what's been going on in the last couple of years. Abid has really seen it front and centre, and so I'm really fascinated to hear what he's got to tell us tonight. Abid, the floor is yours.
Thank you very much, and thank you for inviting me. So I wanted to focus on kind of vaccinations just initially, kind of give us some idea of what we've been doing. We've delivered one of the biggest vaccination programs in history. And a lot of that's been delivered by frontline clinicians, pharmacists, GPs, nursing colleagues, and it's been a massive effort. And as Tracy just said, we're still very much in the pandemic. So the first key message is, if you haven't had your vaccination, whether it's the first, second, or booster, it's not too late. Vaccinations are still ongoing. I know there's going to be another campaign coming up in spring and potentially autumn as well. But even for anyone who's not had it, then please go online and use the national booking system and book in, or check with your practice if they're delivering it in your network, or at the local pharmacies. So if we move on to the next slide, skip this slide to the next one. So I think this kind of slide is really useful to see what we've actually delivered. And you can see it's the first, second, and booster as well. You've got some flu data as well there. And you can see kind of the percentage take up in Berkshire West compared with Corby's, Buckingham, Oxford, and Berkshire. So how do we compare with our kind of peers in the counties above, and the national uptake? So really quite impressive figures there in Berkshire West, across all areas, way above 80%. So slightly dipping below 80 for the second vaccination, but really good performance there. Can we move on to the next slide? So this compares the local authority with similar local authorities across the country, and you can see that in West Berks we're ranked 3 out of 8, again across the first, second, and booster categories, which again shows the significant amount of effort that's gone in and the work we've done with our communities to get everyone vaccinated and boosted. Okay, next slide, please. A bit more detail here, breaking down by cohort in age cohort. So starting at the top, significant amount of work that's been done with our frail elderly in the care homes, and really impressive figures there. I'm not quite sure in that third column at the top why the COVID booster is at 76%. I think certainly from my kind of recollection, we look after loads of care homes in Newbury, in central Newbury, 6 in total, nearly 300 patients, and I know we've gone out to deliver the booster campaign to all of them. So maybe the data's not quite right there, but as you can see, significant numbers of our frail elderly population have had the vaccination. As you go down the cohorts, so if you look at the bottom, there's some kind of orange and red markers there. So the younger age group, it dips. So certainly for the second and the booster vaccinations, we're looking kind of low 70s, and certainly the 12 to 15 at risk group, there's a figure of 51% there. So I think there's still probably a bit of work to do there, and we're still encouraging. As I said, we've written out to all our kind of patients on the registers. They've all had text messages, they've all had letters, but I think going forward, yeah, there's a bit of hesitancy there. I'm not sure why. Certainly the younger age groups where we could improve those figures. Okay, next slide, please. So this slide shows the data for kind of our ethnic, minor ethnic groups. So white, other, Asian, Black, and other ethnic groups. And it kind of gives you a breakdown of the kind of percentage populations and the numbers we've got in our patch, and then those who have only had the first dose, second dose, kind of those who've had the booster dose, those who are still eligible for a booster dose. For example, in the top column, white other, we've got nearly 1,600 patients who are still eligible to have their booster, and out of the total population, 2,729 who have not had any vaccination or unvaccinated. So and then the next columns, you've got the Asian, the British, Asian, Indian, Pakistani. So still a fair amount of people there if you look, and this data I think is up to the beginning of March. So and we've worked really hard, and there's been a lot of work on kind of engaging our communities and myth busting as to the benefits of the vaccination and protection. But I think still ongoing, as you can see, there's still a fair number of unvaccinated patients in the community. So we need to continue that work, and we need to make every contact count when we're dealing with patients, or we're seeing patients for other things, and just checking have they had their vaccine. If not, what are their concerns, and seeing if we can push that and getting the messages out through the various forums and channels and faith groups and so forth. And actually going out to the communities, there's been a bus that's been going around, and they've had talks in mosques, for example. So really kind of reaching out to those communities and making sure they understand and trying to allay any fears they have. Okay, next slide, please. So this is an interesting slide as well. So Tracy talked about our kind of clinically extremely vulnerable patients. We've got a number of categories of vulnerable patients. So patients on the learning disability register, carers, SMI, serious mental illness, those who are housebound. So again, a lot of work and effort has gone into making sure that we reach these patients and improve our vaccination rates, and reasonably good, quite high figures. The seriously mentally ill kind of registered patients, those, for example, paranoid schizophrenia, psychosis, and bipolar disorder, for example, severe depression, that category, we can see they're always a difficult group, for example, to reach. Flu uptake only at 50%, is not acceptable. I mean, we need to do a lot better with that group. And we've just signed off a project at the moment where we're going to use care coordinators in practices to do some outreach work. So most practices have care coordinators and to kind of, actually speak to carers and find out, direct to patients, maybe even go out to patients, do home visits and so forth, and see why they haven't had their booster, because the booster figure is only at 75% for that category, that cohort, as well as the learning disabled patients. So I think there's still quite a bit of work to do there, and it's certainly a focus in reducing health inequalities for the CCG and primary care. And hopefully over the next month or two, with this new project that's just been signed off, we'll make significant inroads into our learning disabilities community and those on the SMI register. Housebound, really good figures there, because all the GPs and district nurses have gone out and made sure that we hit that cohort and get them vaccinated and boosted. And the clinically extremely vulnerable patients, obviously good numbers there, because they were priority and a very highly engaged group. Okay, I think I'm on my last slide. So next slide, please. Yeah. So this is just an example of kind of uptake. I thought it'd be interesting to show of our kind of more communities in the more deprived parts, West Berkshire, and kind of uptake there. So you can see that reasonably good uptake for the first and second, but it kind of does drop off, for the booster, although reasonable figures for the flu. So I think, again, for the current campaign and the spring campaign and the winter campaign, autumn campaign that's coming up, we just need to think, we need probably more innovative ways of reaching these communities and getting the message out there and ensuring that they are taking up these vaccines. And it's not just these vaccines, there's other vaccines that are entitled to, for example, shingles vaccine, pneumovax, so there's a number of vaccines which are available free on the NHS that these communities, we need to make sure that they're getting. I think that's it on the slide pack. So what else are we doing in primary care? So we're still seeing a fair number of positive cases of COVID at the moment. And we've got a program where we get alerted of those patients as the results come through on a daily basis of positive COVID tests. And we've got remote monitoring facilities that have been set up over the last 12, 15 months where we contact patients, and most practices signed up to this. So you contact the patient if a positive result comes in, either by text message or a call. If they haven't got a mobile, or you think they're vulnerable and they need a phone call, and we ask them that if they're unwell, and we've been notified that they've been tested positive. If they're unwell or they need help, please come to contact the surgery, and they'll get a call back from a clinician. If they are in a vulnerable group, clinically extremely vulnerable, frail elderly or asthmatics or diabetics, or they've got morbidity conditions, then they are entitled to a SATS monitor, which they can send someone who's not positive to come and collect from the surgery. They get guidance with it. They can monitor their own oxygen levels at home. And they get a simple protocol that says if your oxygen levels, for example, drop below 92%, then you need to let us know that's urgent, and we will need to get you assessed in one of the acute facilities, for example. So that's one scheme that's ongoing. Obviously, there's ongoing support for patients who are struggling with some of the post-COVID symptoms. So the definition, we'll come on to this, of long COVID is usually symptoms beyond 12 weeks, but there are plenty of patients before that who are still struggling either physically or mentally. So we need to identify those patients and help those patients in that kind of interim period. Try to make sure there's nothing investigated, there's nothing else going on. Chest X-rays if appropriate, and if the symptoms are continuing, make sure that they're plugged into the long COVID services that have been set up for both adults and children. And the other thing is, there's been a lot in the press that kind of primary care has been difficult to access over the kind of pandemic. We're open for business. We're seeing more and more face-to-face patients. Yes, you still have to wear a mask in the sector because we need to protect not only other patients but health colleagues. So, but absolutely open for business and seeing patients face-to-face. Thank you. That's all I was going to say.
Thanks a lot, Abid. Before we get to the questions, I'm going to fill you in that opening poll, because we've got some results back from it now. Remember, we asked how confident you are about the guidance for living with COVID. We're not badly off in this audience. About 50% of us said we're fairly confident, and of the rest, 30% not very confident, 10% not at all confident, and 10%, good people that you are extremely confident about. So there you are. We're fairly confident, but not very confident. So we've all got things to learn. So that's our initial poll. Let's see how much that shifts when we get to the end of the evening. There have been a couple of questions that have come through, which I think you might find interesting, Abid. The first one, I think this is a really, really pertinent question. I'm really keen to hear your thoughts on this one, and maybe even the thoughts of the other guys. Jennifer says, my daughter is 21 and has refused the vaccine due to what she's seen on social media. And of course, as we've all seen this, what the doctors don't tell you, people have been posting all sorts of things on social media. What do you do about that? How does it make you feel, Abid?
Yeah, it's interesting. Yeah, social media is certainly among the younger generation very, very influential. And it's difficult. I think all you can do is get the counter narrative out there. For example, in the early days, there was a lot of misinformation. Well, difficult to say. There's a lot of information out there that said that, well, there's misinformation, not that. If you get the vaccination, then it will affect your fertility. So, and I can understand, a lot of young women worrying about that, quite rightly. Even some of my staff were worried about it and kind of were thinking they didn't want the vaccination. So, I think, and so we sat down with them and we said, look, yes, nobody can say 100%, but the evidence from other kind of trial work and previous vaccinations has shown that this doesn't affect fertility. There were national messages as well. So I think you just got to invest the time, certainly, with some of these kind of populations, and kind of get the counter narrative out there, and messages across, and say, you've got to weigh up the pros and cons. And at the end of the day, everyone has the right to make their own choice. But I think as long as they're getting the right information, they're entitled to that. And some people may take a view that actually they're young, fit, and healthy, and they don't want to suffer side effects. And that, yes, there have been some side effects as well. So it's not completely true that they're, it's completely 100% that you won't have a problem. If there have been some, very small percentage of patients have had 1 or 2 issues, and everyone may suffer different side effects. So I think you just got to say in the round that yes, then very small risk potentially of things happening, but overall it's a greater benefit. The pros outweigh the cons.
Well, actually, before we get to the next question, I actually think I want to put Tracy in that one, because as a director of public health, it's really something which I'm sure is of concern to you, Tracy. Do you think we should be having official campaigns to counter misinformation and untruths on social media, or is it better just to let these things die their own death?
I think as much counter argument as we can get out there, the better, really. I think vaccination is the greatest gift of our generation and the last generation. And we see when vaccination goes wrong, when misinformation creates the most devastating consequences. And we saw this with Wakefield around the MMR and his linked causation of autism 20 odd years ago, and the devastating impact that has had, where measles generally we see real impact in young adults, so people in their late teens and early 20s, and that is this generation's late teens and early 20s. And a nation that was free of measles has now got measles back, and not only that, outbreaks of measles. This was a disease that we had all but eradicated, and through misinformation meant that a generation of parents didn't vaccinate their babies. And now we're seeing young adults left with terrible consequences of measles and even death. And I think there has been a lot around this vaccination, the speed it was created and all of this. The fact that it was done quickly is the credit to our science and the benefit we have, that we have this science in our armour, and that it could be developed at pace, not because of shortcuts, not because we wanted to shortchange the public, but because we had a global pandemic on our hands and we wanted to save lives. So vaccination for me is the greatest defence we have against infectious disease. And I think, we wouldn't leave our doors open. We lock our doors as defence from burglars and people coming into our homes we don't want. Vaccination is that with a communicable disease. So why would we not do it? Why would we not protect ourselves? There's no benefit of science trying to mislead the public on this. So for me, if we can get a counter argument out there, then let's get that counter argument within our communities and get people vaccinated. We have herd immunity, and we think, well, if enough other people do it, then I'll be safe anyway. That doesn't work. You never know when you're standing next to another person that hasn't been vaccinated. So protect yourself and protect everybody else. It's the greatest gift we can do for each other.
Julian picks up on a relevant point to this. He says Greenham is a ward that has a high level of deprivation relative to most other wards in West Berkshire. Is that a potential factor in the lower uptake of the booster in Greenham compared to Thatcham?
That is a brilliant question, and I haven't looked at the data enough to know whether that is a fact, but what we have seen is definite correlation between deprivation and incidence of COVID. And we saw that in the early stage, and we saw the rise of the conversation around health inequalities based on that. So we know that people living in more deprived areas, we've seen higher levels of the infection itself. But that is certainly something that I'll go away and look at in terms of that correlation between vaccination uptake as well.
I want to pull Abid back in on this next question that's come through to us. It's good to hear the GP surgery making contact when a positive test is advised. I was wondering if people felt isolated from their GP once they've contracted COVID. Abid, I'm sure that's something that's really important to you guys, and you've been aware of people may perhaps feeling isolated. Have there been things that GPs have done to try to overcome that?
Yeah, I mean, from my personal experience, anyone who's had contracted COVID has become, if they're worried, what we've done is not only contacted them, then they've had regular kind of follow-up calls. In the early days, we'd schedule them for a follow-up every 48 hours or 20, depending on 24 hours, whatever they needed based on individual need. And so we provided quite a proactive service, so they didn't feel isolated. And if they were worried or they didn't know how to use the SATS-Montreux, they were worried about the oxygen levels. What did they mean? You know, we had someone on site and monitored their clinical kind of symptoms if they were getting more shortness of breath, so forth. So I think and certainly most of my colleagues I know were doing that as well. I mean, yeah, I mean, there may have been others out there who perhaps felt they struggled, but throughout the period, you know, there was always kind of it might not have been face to face as much in the early period, but there was certainly kind of video or telephone contact with patients or their carers, you know, if there was any concerns.
We learned that pregnant women are not taking up the vaccine. Have there been things done to particularly engage pregnant women and to reassure them? Yeah,
the midwives have done quite a lot of work, and we have practice-based midwives, and you know, when they see them to discuss the various vaccinations, that then it's not just COVID vaccinations, other vaccinations as well, if they're missing MMR or things like that, the measles, mumps, rubella, that is. There's excellent leaflets which I've used with patients of mine who've queried whether they should or they shouldn't. They're not sure, from the Royal College of Obstetricians and Gynecologists. Really good, either directing them to the website or printing off the leaflet, which goes to the pros and cons. But they are, you know, and they are higher risk. They are a category, you know, who are more prone of developing not only COVID but complications of COVID. So. But there's excellent kind of literature out there, and I think if you go through that and reassure women, you know, that as much as there is the evidence out there that is safe for baby and mum, from all the kind of evidence that they've got to date, then most of the women I've kind of dealt with personally have decided to take it. But yeah, again, a lot of stuff, information on the internet as well, you know, and so I think people go to Google, the first thing to do is Google stuff, you know, and there's a lot of, you know, not validated information out there. You have to be a bit wise as to what you're reading.
Before we move on to the next topic, there's one more thing I really want to ask you, Abid, because you wear quite a number of different hats locally with the Wellbeing board and as a CCG person, and then as you said, frontline GP right in the middle of town. This thing broadsided all of us when it turned up, and we know it wasn't easy for members of the medical profession. For you personally, what was the most challenging time for you in this whole thing? And when you look to the future now, how confident do you feel about how we are coping with COVID as a society?
Yeah, really good question. I mean, I think initially I was like everyone else. I was, you know, so I was scared like everybody else. And the first thing, you know, and I think as data was coming through and saying that male Asian people of, you know, my background and my age group were high risk, I was really worried. I'm going to be, you know, straight up with you. So in the early days, you know, I kind of did a lot of my consultations remotely. And I think, but as there was more data and, you know, became more confident with the infection protection, so forth, you know, began to see more and more patients face to face. But it was a trying time and a challenging time because, you know, we even though we weren't, you know, seeing a lot of face to face patients, we were still dealing with a lot of, you know, we had the vaccination campaign as time progressed. It was a lot of effort there. Setting up COVID hot hubs. So for those of you know, patients who may have attended one, you know, we set up a big hot hub in the Newbury racecourse, took a lot of time and effort, was involved with that. So we were busy, and now it's a lot of pent up demand, you know, so you probably heard that primary care is under a lot of pressure. So the pressure continues. So it's been a tough, challenging 2 years for a lot of healthcare professionals. But I think we're coming out of it on the other side, and hopefully, you know, going forward, you know, we'll have to live with this, you know. So it's just kind of, you know, how do we all safely live with this in the future?
We've got one more good question to go through, which I know you'll be able to deal with. Why aren't we doing antibody screening before giving a booster?
Tracy might want to come in on this. What are we not thinking? I think probably logistics is probably one thing. Would it make a difference? So what if you did antibody kind of testing and if you were high, would you then not have a boost? I don't know. I'll defer to Tracy. He's probably more of an expert on this than I am.
Tracy, what do you make of it?
We'll use the term expert loosely. Yeah, I mean, logistics is one thing. I mean, the lab capacity to do something like that would be extraordinary in terms of the infrastructure that would be needed for something like that. And equally, if you've got antibody protection, be it from having had COVID or the fact that you've still got protection from a previous vaccination, that wouldn't mitigate the need for another vaccination, because, you know, we're seeing the need for the booster to give you that top up, which has been really vital. So I don't necessarily think it would change the practice. So in that point, it's an unnecessary and potentially very expensive and necessary step that we'd need, because I don't think it would change the recommendations we were doing at all. We'd still be recommending the same amount of boosters, the different number of vaccinations. You know, we've seen people need 3 vaccinations and a booster for those that are immunocompromised or for various other reasons. So it just wouldn't change practice. So it'd be an unnecessary step.
Yeah. There are a couple more questions that I'm going to defer for now. Really good questions because they're about people's personal experience, from Francesca and from Maddie. And I know that our next speaker, Anthony, actually wants to pick up on those 2 questions at the end of his session. And so I'll let him do that. And indeed, we'll move on to our final talk of the evening from Dr. Anthony Collins. Anthony is a GP and he's part of the Berkshire Long COVID team at the Royal Berkshire NHS Foundation Trust. Anthony's actually been a GP for 20 years, and about 13 to 14 years of that experience has been in Reading. He's been involved with the Long COVID Clinic for about 16 months now, which is why Francesca and Maddie, he is the right man to address your very, very realistic concerns. But I'll hand over to Anthony now so that we can hear from him.
Thank you very much. Are you able to put the slides up for me as well? Hi, everyone. Thank you very much for inviting me along. I've got slides with quite a lot of information on, which I'll go through quite quickly. If you miss anything, you're more than welcome to ask for copies of the slides from Alice or anyone with the organisation afterwards. If you could move forward, you can go to slide 4 actually, because you've covered slide 3 in my introduction. Or back one. Oh, that's it. No, that's the one. Yeah, forward. Right, so I'm just going to try and answer some of the questions about long COVID itself, and then talk a little bit about the service we run up at the Royal Berks Hospital. Just to start off with what's supposed to be a definition of long COVID, although it's obviously very open to interpretation. The official definition from the organisation that kind of comes up with these things in the UK is signs and symptoms that develop during or following an infection with COVID that continue for more than 12 weeks and are not explained by another diagnosis. Obviously, you can get symptoms way before this, but this is kind of the arbitrary kind of cutoff that's been given. The biggest experience I've got from people I've seen in the last few months, it's a very real and debilitating condition. And as I can see from some of the questions, the biggest difficulty people still face is a lot of people out there just don't believe that it's real and don't understand how debilitating it can be. But hopefully I'll be able to show that as we go on. Most importantly, to have long COVID, you don't even have to have had a positive swab test. Obviously, this was particularly applicable for people getting COVID right at the beginning when swab testing wasn't routinely available. As long as you've had the relevant symptoms that fit in, and obviously the particular one is the loss of taste and smell that differentiates it from other illnesses, you can still develop long COVID, and that's not a bar to receiving advice or being referred into our clinic. Next slide, please. So what are the main symptoms? That I'm going to show you on the next slide. There are hundreds of different symptoms you can get, but I guess these are the ones that my experience and what the literature says are the most common. Number one, top of the list for the vast majority of people is the fatigue, the exhaustion. And this isn't just a case of, you know, like when you've had a busy day at work, you feel a bit tired, you wake up the next morning, you're recovered. This is in some cases people that literally just walking down the stairs from their bedroom exhaust them to the point where they then have to rest for an hour. You know, they might not be able to walk any further than, the end of their garden. So, you know, it can be kind of really, really quite limiting. Brain fog, which I think has suddenly become a term that we're all using now since long COVID's come along. I mean, it covers lots of things. I mean, it covers poor concentration, it covers forgetfulness. Some people say they have kind of difficulty with just simple things like reading or watching TV. Some people can't think of the right words to say, but definitely a real problem. Shortness of breath. I mean, again, this isn't for everyone with COVID, but it is quite a big problem. For some people, it's more when they're trying to exercise, when they're trying to do something, some activity. But some people can even get out of breath, even just sitting still, and sometimes find they need to yawn or take sort of a deep breath just to kind of, get things under control. Pain is a big thing, and obviously a lot of muscle pain, as you see with a lot of viral illnesses, but a lot of chest pain, headaches, neck pain, pains in joints all over the body. Again, a really, really common problem. Anxiety and depression. I mean, this is something where I think a lot of people who already have these conditions that get long COVID, suffer more. But we see a lot of people who develop this for the first time with long COVID, just their response to dealing with such a significant illness. What's interesting with long COVID, and again with COVID itself, is no two people have the same two symptoms. Everyone seems to have different varieties, different severities. But a lot of people, they change over time. And one patient once said to me, they talked about the corona coaster, the idea that they might have some days where their symptoms are virtually gone, and then other days when they almost feel as though their COVID's come back again. Next slide, please. I've not listed all the symptoms, but I've read that there are over 200 different symptoms, and pretty much any symptom you can think of, you can get with long COVID. I mean, the ones on the page before were the main ones. I mean, dizziness is quite common. We see a lot of people that get numbness and weakness, a lot of throat issues, a lot of people with difficulty speaking, difficulty swallowing. Sleep disturbance is a really big one. People go to bed at night feeling exhausted, and yet when they actually get into bed and want to switch off, they just can't. And again, a phrase that I've heard is tired but wired. People with pre-existing health conditions, particularly things like diabetes, migraines, irritable bowel, these can get worse when you have long COVID. And an important one not to forget is we know that when you actually have COVID, you're at an increased risk of certain types of clots, but that risk apparently can carry on afterwards. It's reported for up to 12 months. So again, if you've got long COVID and suddenly you get more breathless, or suddenly one of your legs becomes painful or swollen, make sure you get it checked out. It may not just be long COVID. Next slide, please. This is just a survey that was done talking about some of the impact on people with long COVID. Family life is affected in 71% of cases. The big one for people is ability to work. I mean, a lot of people, when they've had long COVID, they're under a lot of pressure from their employers to get back to work as soon as possible, and often go on a phased return, which their employer deems to be maybe over 4 weeks. Some people take months to get their way back, and as you can see, 22% of people still not working after 6 months. I mean, this is not from our clinic, this is sort of national data, but it's a really big thing. And obviously a lot of people, they need to earn a living, they need to get back to work for that reason. But unfortunately, the amount of time and effort they're putting into work is actually sort of hindering their recovery. And that's a really big, important factor to take into account. Next slide, please. Just very briefly, I mean, this is just I guess an obvious slide, but just saying that the pandemic in general has obviously changed, everyone's lives immensely. Isolation, loss of jobs, obviously reports of increased domestic abuse, which is worrying. Not forgetting the impact, I guess, on frontline kind of health and social care workers as well. Hopefully, obviously, with the pandemic with us coming out of it, some of these things should hopefully improve. Next slide, please. How common is it? If you try and look up online, I mean, there are just completely different figures that are there. I mean, the current figures, the best I can get is they say somewhere between 5 to 20% of people have symptoms at 12 weeks after COVID. If you've been admitted to hospital, obviously people sometimes get very sick, end up being ventilated. Up to 60% of patients, still have symptoms after 3 months. Next slide, please. I looked these up today, the Office for National Statistics. So as of 31st of January this year, there were 1.5 million people who were still having symptoms 4 weeks after having COVID. After 12 weeks, the sort of cutoff for long COVID, 1.1 million people. And after a year, 685,000. I mean, these are huge figures. And it's just, this just isn't recognized by so many people in the population. And again, the bottom line saying, people's activities are affected. Close to 1 million people still have restrictions on their daily activities because of long COVID. Next slide, please. This is something we've picked up within our clinic, but again, is kind of in the literature online. The number one, it's so much more common in women, and we don't understand why this is. I think within our clinic, maybe over 2/3 of referrals that come in are from females. I don't think, with all the research going on, no one is really sure yet why it's more common in females, but that's a fact. It seems to be more common in kind of working age people. My own feeling of that is it may be that obviously people at working age are having to compete with, doing work, having families to raise. I guess people later in life that are retired, have more time, may not experience as many symptoms because their lives are not as busy, but, we still see people, in their 70s, 80s, we see people in their teens. People working in healthcare, social care, teaching, again, that fits in with our clinic. We see an awful lot of teachers and teaching assistants, a lot of doctors, nurses, a lot of people working in social care. And again, if you have a pre-existing health condition, that seems to make you more likely. Most important, and what we've learned, is that it's not necessarily related to the severity of your initial illness. So there are some people that have had a really mild COVID illness initially, and then several weeks later just suddenly developed profound long COVID with no clear reason at all. Next slide, please. Just quickly on this, I mean, it's probably not of interest to a lot of people, but what causes it? Again, there's a lot of research going on. I mean, obviously in severe cases, people that have been in hospital, the virus may have caused long-term damage to your lungs or your kidneys. For some people, it may be that your body's never cleared the virus and it keeps setting up an immune response to the virus that's there. The main thing for most people seems to be the issue with the immune response. Your immune response it's dysfunctional, it's exaggerated, it's there to deal with the infection and then calm down. In people with long COVID, it doesn't. The body seems to keep thinking the virus is there and it keeps creating symptoms as if you have the infection. Deconditioning, obviously, when you've had long COVID very severely, you don't exercise as well, you may gain weight, you may not eat well, your body becomes deconditioned, that will contribute. And of course, just, the stress of the initial COVID and the long COVID, the effect that has on you emotionally can obviously affect you as well. Next slide. Just a couple of things that people are asking us about. There's theories coming out about the idea that there may be microclots in your blood vessels that could be causing symptoms. I think at the moment, the latest is that there's some studies going on, I think it's South Africa, where they've actually been treating people with blood thinning agents and found that it's helped their symptoms. But the general feeling is it's such a small group of people they've done the studies on that we really need to learn a lot more about that before we give these medications to everyone. But certainly within the next 6 to 12 months, some of these things may start to become standard treatments. And this idea of neuroinflammation, although the COVID virus doesn't necessarily cross into the brain, it triggers off inflammation of the brain, the central nervous system. And we think that causes a lot of the pain and brain fog that people experience. But it is thought to be reversible, which is very encouraging. Next slide, please. How do you treat long COVID? Most of what we do now, even 15, 16 months in, it's giving advice that there really isn't as yet any one medication that works for everyone. Lots of people try over-the-counter supplements, people try sleeping tablets, antihistamines, all sorts of things. We don't necessarily push most of them because they don't work for everyone. I mean, I've mentioned at the bottom about vitamin supplements again. I mean, you know, if you've got a good healthy diet with everything you need in it, you don't need to take vitamins. But, you know, if your diet's not so good, then yes, certain things like vitamin C, vitamin D, zinc, you know, can help with your symptoms. Pacing is the number one important thing. And this is really a way of saying that with your fatigue, if you try and push yourself to get better, you will actually get better more slowly. So a lot of people have this idea that, you know, if you're walking a mile today, you need to walk 2 miles tomorrow. No, you need to walk well below the limit you can reach, and you need to be comfortable at that level before you can increase. So we say that when you're ready to go up with exercise, increase by 10 to 20%. You know, if you can walk a mile, you know, make sure you can do that for a few weeks, you know, and then go up to maybe 1.2 miles. Don't just suddenly try and double it. And again, with work, people are just exhausting themselves with some of the work they're doing. You know, if you don't have that phased return, you know, going back, if you don't have the understanding of the employer, you know, that can really slow down your recovery. And that's one of the biggest things we see. Breathing, I mean, obviously there are lots of reasons why people can be breathless, but a common thing we see is something called breathing pattern disorder. And this is where people who've had COVID have sort of learned an abnormal way to breathe. They take much shallower breaths, and that can sometimes contribute. And we have respiratory physios within our clinic who teach specific exercises. They're available online as well, that can help to kind of control your breathing, and that can help the symptoms. And obviously just general things like mindfulness and well-being. Next slide, please. Where to go for help? I mean, obviously here tonight for starters. I mean, there's a lot of excellent information online. A lot of people that come see me in clinic have joined support groups, and I think that's particularly helpful, especially for people living alone or people that don't have, you know, immediate friends or family to talk to. It's good for people to share symptoms. Obviously, it's important to reach out to family and friends when, you know, when you're being affected by this. We talked about occupational health for people in employment. It's really important to, you know, get your employer to refer you, to, you know, to be given support in getting back to work. Our consultant with our clinic has actually set up a series of podcasts called Pain Speak, which you can just Google online. He's interviewed all of us in the clinic. He's interviewed a lady specifically who gives tips on brain fog. So there's a lot of stuff on there. Talking therapies is out there for people with, you know, psychological and emotional needs, and that's something you can refer yourself to. And obviously the GP surgery. I mean, it's very important to find the right GP. I mean, my experience of what I hear from people coming in is there are some brilliant GPs, some supportive GPs, some GPs not helpful at all. I think within any particular practice, you need to find someone that has an understanding of long COVID and is sort of sympathetic to your needs. Next slide, please. So just very briefly about our service. This was started in December 2020. It was set up by Dr. Deepak, who's the pain consultant at the Royal Berks. He'd been thinking about this long before then, but funding came from the government to allow us to set up these clinics all over the UK, which was brilliant. It's only running 2 days a week, and this is the biggest problem. Even with the funding we have 1 day on a Monday when all the staff are there, which is 6 altogether, 2 of us on a Tuesday, and then 2 staff for the rest of the week. And I'll come on to really that's why, with some people's questions, why people are having to wait so long to come in, just because of limits in the number of staff running the clinic. You need to have certain tests done before you get referred, just to rule out other things, so blood tests and x-rays. And when you come into our clinic, obviously we talk through the symptoms in more detail. We can arrange further tests, but then we can discuss what kind of things are available to help. Next slide, please. So yeah, just briefly list people in the clinic. There's myself and Dr. Deepak. We have 3 or 4 specialist physiotherapists, and we have a new occupational therapist who's just started with us as well. One thing that's coming out is Berkshire Healthcare Foundation Trust. This is a sister organisation to Royal Berks, and they're, as of January, taking on a lot more of the actual treatment work. So they're now setting up groups to actually kind of manage people with long COVID. Next slide, please. So yes, since our clinic opened, we've had over 1,300 people referred in. We've seen more than 800 of those, but there's still 500 people outstanding. Even at the moment, the waiting time to be seen in our clinic is up to 26 weeks, just with the sheer number of people coming in still. The percentage of people referred in from Black, Asian and other minority ethnicities are 27%. Next slide, please. Just to show again an audit of people that have come to our clinic, just clarifying the main symptoms there we talked about before. Again, I would agree with that. Fatigue, brain fog, breathlessness is definitely the three most common. Next slide, please. Just a very brief slide just to say about what we do within our service. Obviously, we find out more about how it's affecting you, the impact it's having. It's important that we make sure from the story that patients give that there isn't something else going on. We try and find out what people's expectations from the service are. Some people are just glad to come in and talk it through. Some people are wanting further tests to rule out other things. Some people would need specific help on specific symptoms. So lots of people needing different things. We talk a little bit about our understanding and the long-term recovery. And obviously we point people in the direction of self-help resources as well. Next slide, please. The outcome, so obviously we can refer on to other specialties if there's unusual things going on. We can refer, we can arrange spirometry, which is a breathing test, ECG. A lot of people we've referred on to, or enrolled on rather, onto the Living with COVID app, which is a program set up by a long COVID team in London. And that's for people who maybe haven't got the time to kind of commit to something regularly during the day, but it allows them to log on, go through their symptoms, learn how to manage them, sort of keep a log of their symptoms, but also keeps a link with our clinic so people can discuss things further. We talked about Berkshire Healthcare setting up these group programs. A lot of people we saw last year, we're only now able to get into those programs. And actually what's been really useful is we've had some money from NHS charities. We've actually been able to set up some partnerships with a few organisations. Nirvana Spa is particularly popular with their salt therapy pool. And these are things that we can refer people on to just for a little bit further kind of, TLC and help at no cost to the patient at all. Next slide, please. Yeah, I think my take-home message when I see people is to say, look, it's a very real condition. And even if people individually feel quite isolated, I say we're seeing people, week in, week out with very similar symptoms and going through similar difficulties. So we appreciate how difficult it is, but a lot of people, do feel quite isolated. The recovery period is very unpredictable. I mean, I've seen people that have had it in the last 6 months who are getting better. I've still got people from 2 years ago that are still not improving. So again, going back to this idea that everyone recovers at different speeds, but also give people hope that over time with the right help and support, things should gradually improve. And the vast majority of people I see, even if it's slow, are slowly improving over time. Next slide, please. Can it be prevented? I mean, the obvious one is don't get COVID in the first place. Echoing what kind of Tracy said, I mean, obviously public health measures, government kind of mandates have sort of largely disappeared. But again, yeah, my own personal feeling is, just simple things like washing your hands, when you go into shops, wearing masks if you can, just such small things to do, but can still make a difference, reduce your risk of getting COVID, which then reduce your risk of getting long COVID. And immunisation, again, is very important. I mean, not only for the reasons discussed, but interestingly, there's some evidence that actually being vaccinated can actually reduce the likelihood of getting long COVID as well, which obviously is good to know. Next slide, please. So yeah, just briefly, the collaboration with Bliss, and I've spoken to my consultant who's been mainly involved with this to get some information. Obviously, there's tonight's meeting. My understanding is a website's going to be set up, which is going to contain a lot of relevant information. I understand there's going to be a weekly show on Kennet Radio, which is going to, each week, I think a different sort of member of our team or Berkshire Healthcare are going to be invited on to sort of talk through their kind of area of knowledge and expertise. But also certain GP surgeries are, taking on kind of pilots to sort of upskill members of their team to try and manage some of the workload so that not everyone has to be referred into the Bliss service at the Royal Berks. Next slide, please. So just a final slide on my experiences of what I picked up, I guess, from the last sort of 12, 15 months. I'm always amazed by what patients are already doing to improve themselves. the optimism amongst people I've seen is amazing, even amongst people, that are profoundly affected. So many people are really doing everything they can to get better. I'm obviously amazed but frustrated by the number of people, that still have symptoms even after 12 months, even after 2 years, and the effect it's having on their lives. Fascinated in a way by the number of different ways in which people present. The age range, again, even that's changing. Now even younger children are starting to come in with long COVID. And the bottom line, just the fact that the severity of your initial illness doesn't necessarily predict whether you'll get long COVID or not. And that's for people that have mild illnesses or people that sort of poo-poo COVID and say it really isn't anything. Saying that to people with long COVID, they would say, look, this is very serious, very real. And that's the end of my talk. Thank you very much.
Thank you very much, Anthony. There's been so much detail in there, so much to tell us. And actually, as you've been speaking, there's also been the most amazing conversation going on.
I can see
in the chat window. And it's just lovely to see people supporting one another in the way they have been. I should say to any of you who haven't been looking at the chat window, particularly if you've had employment issues around COVID, there's some really good advice being posted there tonight, and I think you maybe want to read down through the chat and see some of the support. It's interesting when you're the guy who got the job of talking about long COVID. It's produced some of the most extraordinary responses and some of the toughest questions. So I guess before you get into the really tough stuff, we should start out by saying that Jennifer really early on, who's one of your own patients, said he's brilliant. So I think we need to take that into account. Early on, you've seen the comments from Francesca and Maddie, who felt that in the long COVID clinics, they just weren't having their needs met. Is there anything in particular you want to say to them?
I guess it comes back to, I think, obviously from our point of view, we sit there every week, we see people come in, we almost, have little idea of how long people are actually waiting until we see the figures. I guess it comes down to the fact, that there's 6 members of staff, working, 2 days a week, covering the whole of West Berkshire. And you can see we've had, almost sort of 1,400 referrals. And it's just frustrating to us that actually people get referred in, there's then the wait. We then actually triage the referrals, which we're not doing for several weeks. There's such a backlog. And then even once they've been triaged, then to get seen in the clinic is another several weeks. Apparently, there's a discussion now that the waiting times, I think this might be a national thing, have got to come down to 16 weeks. I have no idea how you're supposed to do that with limited staff. But I think talking to Deepak, my consultant, I think he said that obviously, the main thing, and that's part of this meeting, is trying to encourage people to get help from as many different places as possible to try and limit some of the workload on the long COVID service. We're happy to see people, but so many people want to see us. And I guess that's the difficulty. There just isn't the time, I guess, and the capacity to see everyone. And we're as frustrated as everyone else, but certainly the people that do come in, we really try our best to help as best we can.
Yeah, that really comes through in the comments actually as well. Shane, who we heard from earlier, says, I'm not even remotely close to who I was pre-March 2020. Physically and mentally, I'm altogether different. And a younger friend who saw me recently told me I look and move so old now that if they did not know me, they would already think something was terribly wrong. So why is it so hard to get the medical profession to understand this as well? And that kind of reflects a lot of the comments we're saying, people saying, just nobody understands this. We've been to the doctor and they don't get it. I had difficulty getting diagnosed. We've seen lots of that coming through in the chat. Do you feel there's a need for a wider awareness thing amongst GPs or amongst doctors and more training? Is that something you sense?
Absolutely. I mean, in terms of people that come in, one of the biggest things that people say when they come into our clinic is, within 10 minutes of talking to us, they are sometimes said, you're the first person that actually understands what's going on. You're accepting these symptoms. You've come across them before. No one else has come across this. And I think, even GPs out there, we're all aware of long COVID from the media, from patients that we see. And yet, I guess, it's all down to individual kind of people. Some GPs want to take that interest, want to learn more. Some, don't have the time, don't have the inclination. It's very kind of, very variable kind of across the population, I guess. But I mean, certainly from our point of view, I mean, yes, I mean, we right at the beginning did a talk for all the GPs. And I think, you know, one of the things that's coming out of this is that we're probably going to need to do an update one to kind of update people a bit more. But Abid probably knows, but I know that some practices are setting up pilots where they're actually starting to run some groups within the practice where sort of GPs, counsellors, dietitians are trying to, you know, help some of the patients within practice to save them being referred. But yeah, it's you know, we hear some people come in and say their GP's been brilliant. They've, you know, spoke to them lots of times. They've done the relevant tests. So you know, there are some, you know, good GPs out there as well. But yeah, I think in an ideal world, you know, every GP would know, you know, all about this and how to manage it. But I guess it's, you know, that's, you know, it's going to be a long time coming. But yeah, I think the understanding should be a lot better. Yeah. There's a lot of really interesting stuff coming through in the chat about some of the perhaps non-medical interventions. And some of the, actually one of the nice comments earlier on was Leslie, who's up there in Scotland. Great to see you joining us from so far away, Leslie. That's absolutely fantastic. But said there's a whole new lexicon around COVID. There's a whole new language that we all need to learn. But she's also been talking about how people support one another, about a writer's showcase that they've got up in Paisley, peer support groups. I've been reading stuff about pools of various kinds, all manner of things. Now, as medics, are you getting involved in directing people towards that kind of peer-to-peer support and perhaps not directly medical support, but stuff that really does seem to be helping people? And we're seeing things like apparently the writer's showcase helping people's cognitive ability to recover. As medics, are you signposting people in that kind of direction? I guess from my point of view, of course, by the time they've come to me, you know, it's already a long way down the line. So it's probably better to ask Abid as, like, you know, a jobbing GP at the moment to see what he thinks about that.
Yeah. I mean, not necessarily peer-to-peer. I don't know of any kind of peer-to-peer support, but I suppose that's something that probably will develop. But certainly we use our social prescribers to direct people to various kind of alternative therapies and what's available in the community. For example, I think on the list, you had the West Berks Therapy Centre. Yeah, so that's really good. Kind of hydrotherapy and so forth. So yeah, I mean, all these kind of alternative treatments where they're available, anything really to help kind of from a lifestyle point of view. But the social prescribers, and I think going to the point of education for GPs, I think you're right. I think I agree. I think another round as you did previously would be really good. I thought your presentation was excellent. So I think we're kind of so under the cosh at the moment with so many things, and you know, education again, and reminding colleagues and across the spectrum, you know, not just GPs but all allied healthcare professionals, physicians, associates, paramedics, all these other kind of colleagues are working in primary care. So I think even, you know, sending out the slide set, and we are as part of the national programme. You know, we were told that we have to be vigilant, quite rightly, about long COVID symptoms and referring to the services that have been set up as just described. So, but I think there's always more to do. So I would welcome further education. I think it'd be a really good thing. We could easily do something like that, just over Teams, over a lunchtime session. Again, I think that'd be excellent.
There's a question also about whether things have been done to particularly engage with ethnic minorities who tend to be disproportionately affected. Are there particular actions that can be taken to make people from ethnic communities more aware and more responsive?
I guess that's really what this project's all about, isn't it? I suppose is the simple answer to that. And I mean, from our point of view, I mean, I think, you know, every GP in West Berkshire is aware that, you know, that our service is there. I think there's been some discussion around, you know, should patients be able to refer themselves directly into the clinic? And I think the couple of things of that is, one is, as you can see from our figures, I think if everyone referred themselves in, you know, the service would just collapse anyway. But also, as we said, some people do have other things apart from long COVID. So actually having some of these kind of basic tests done before you come in, you know, like X-rays, like sort of blood tests and things, is actually really important, because you do uncover other things that are not just long COVID. So, but yeah, I think it's, you know, hopefully by this talk as well tonight, people, you know, more aware of long COVID. There may be some GPs that are still not aware there even is a long COVID service. I'd like to think most people are, but I guess it's easy from where I'm sitting with my knowledge to have grown over 15 months, but I forget that, for most GPs and most people out there, long COVID is just one thing they're seeing, in addition to sort of hundreds of other things. So it's, I've got quite a sort of a narrow warped view, I guess, really.
Yeah, I just had a message through to say that I should really highlight that the Nirvana Spa is in Wokingham and the West Berkshire Hydrotherapy Centre is in Newbury. We advertise everything here. For those of you in Paisley, that may not be particularly pertinent information, but for many of you it will be.
And floating point in Pangbourne is the other one.
And floating points in Pangbourne. Well, these are important things for people to know. There's places where people can get help. And someone says, "Oh yes, Leslie, you'll be googling pools up there in Paisley." That's good. That's good to know. I'm looking through some of the other questions to see what else we've had. Yes, Shane brings up the point about some of the services that are available online are difficult to access because his eyesight's been affected, his ability to concentrate for long periods has been affected. So sometimes there are different types of services are needed for people who've experienced particular symptoms. Is that something you've come across?
Yeah, I guess again, it's easy sort of from where I'm sitting, I guess, but we when we see people in our clinic, we have 45-minute appointments, which sounds wonderful, but by the time you've gone through the story, given advice, checked everything, the time goes very quickly. A lot of people need ongoing advice and support about different symptoms. We do have our own workbook we put together, and I should have mentioned that, and I think it's actually available on the Royal Berks website, but if not, I can send a copy to Alice. But first of all, we've just got some written information and links to other kind of resources. The app that was set up, I think, was really a way of trying to help some people when, to begin with, we didn't have the actual ability or the capacity to actually keep managing people. There's so many new people coming in, but where Berkshire Healthcare have now taken on board with the groups, we're now able to see people and then refer them on to them. And they're also going to take on some one-to-one work. So if people have particular, needs around pain or fatigue that need more specific advice, that's going to be available kind of going forwards. And also they're going to be doing a lot of groups, although in fact they've started already. They've already run similar groups for people with chronic pain and people with chronic breathing difficulties. And I think there's up to 10 people are online at a time. It's an hour and a half each week. I think it runs over 6 weeks. And it's just going through different aspects of long COVID and people sharing their kind of thoughts and ideas. And actually that's now going to take a lot of the pressure off our clinic. So we're going to have more ability to actually see the people coming in. So, talking to Shane in particular, yes, I think, the app is good for people that are computer literate, are good with phones. Some people need, that kind of human interaction, whether it's in the group or the one-to-one. And as I say, as of the beginning of this year, that's now become available, which wasn't before. And, we're glad that's come along now because it's allowed us to do more from our service.
Yes, Leslie's saying there's been an excellent session. Can we share on social media afterwards? Absolutely, Leslie, we will. But more than that, I'll say to you, as our long COVID project progresses, we'll have more podcasts, more webinars, we'll have our radio show, and we'll have some other collateral. And we hope there's much more that's going to be produced. It's going to be helpful to people and of benefit. But equally, we want to tell your stories and we want to know what's useful to you. So I hope that everyone who's here tonight will keep in touch with us at Community United after this session. Will tell us what we need to know about the things that you're going through and the things that you can tell us to help other people, because we need your information. So yes, Leslie, we will be sharing, but you've got a massive amount to share to share with us. I think probably actually it would be a good juncture at this point to get Dale, our techie, to put up the second poll so that we can actually do the second poll, and we'll continue chatting after that whilst he counts the votes. But there you are. with the second poll. Please cast your votes, people, and let's see if there's been any kind of a shift in how we feel about these things. Remember, half of us were fairly confident, but no more than that. Whilst you're doing that, Francesca, very good point. Involving patients groups in this work, absolutely essential. Keep talking to us, Francesca. I've found this a really inspiring night. I think we've learned so much tonight from you guys, not just from our speakers who've been tremendous, but from you guys who've been making comments down the side. This is really what this kind of session is all about, and this chat has been absolutely fantastic. I don't know if Dale is counting votes yet. Still counting votes? Is he? Oh, I think we may have a result here. Let me just have a quick look. Oh, aha. Well, now this is interesting. This is a shift. This is a shift. At the start, half of us were fairly confident. Only 10% of us were very confident. 10% of us were not at all confident. The middle has softened a bit. 47% of us are fairly confident. Not much change, just very slightly less. But 10% who are not at all confident have shrunk to 7. We have 13% who are not very confident. But the thing that's really, I think, great, a third of us are now very confident. And I think if a third of us are very confident, that's because of you guys. It's because of not just our 3 speakers, but you people who've been interacting with one another and making this a really inspiring event and an inspiring evening. And I've really got to thank that. So another great session. Thanks to the organisers. No, thanks to you guys. You're the people who are making it happen here, and you're very important. Thank you so much. I'm not sure if there are any more questions coming through. Are there? I feel a bit like an auctioneer now. I'm sort of saying, any more bids before we go. It's been an incredible evening, and I think all of us, I'm sure you would all like me to thank our 3 speakers who have all been absolutely tremendous. But actually, I want to thank you not just for tonight. I think every one of us is indebted to the hard work that's been put in by the medical profession right from the start of this thing. You've been absolutely fantastic. We talked about vaccination earlier on. The thing that's got me, and actually I hate injections, absolutely hate injections, and each of the time I've gone along for my vaccination, my second one and my booster, it's been a pleasure. It's been an absolute pleasure because there've been such nice people who've been kind and helpful, and everything's been just lovely. And that's what you guys have been doing for us. Again, there's a lot of really nice comments coming through thanking us. Well, again, thanks to you guys. I think probably it's time to call on my friend and colleague Julian, who's going to do a bit of a wrap for us at the end of it. Julian, do you want to come along now?
Yes, I will, and thank you very much indeed. It's I might normally have had more to say, though those in the meeting who know me well know that I normally have quite a great deal to say, but although I can't put my experience anything like some of the contributors in the chat. I had COVID 6 weeks ago, and I'm still suffering from a bit of a cough, which keeps interrupting me at very inconvenient moments when I speak. So that's why I haven't been speaking too much. I just apologise in advance if I do get interrupted by that as I wind up. As Brian said, it's thanks to everybody who comes along to our events that make them a success. So on behalf of all of us at Community United, thank you to you all for giving up your time to come along this evening. We do hope it's been useful. We've certainly learned an awful lot. Especially thanks, of course, to our distinguished panel members for their presentations and input. That's Tracy, Daszkiewicz, Dr. Abid, Irfan, and Dr. Anthony Collins. Thank you all 3. And thank you, Brian, for your most excellent moderation. 1 or 2 people have made that comment specifically in the chat. So let me add that comment from myself as well. I should say thank you to West Berkshire Council for sponsoring this event, which is very much appreciated. And just one last thank you I'd like to say on behalf of all of us at Community United is to Matt Pearce, who's the Service Director for Public Health at West Berkshire Council, but not for much longer, because Matt is leaving West Berkshire to take up the post of Director at Public Health at Herefordshire, I believe. So from all of us at Community United, thank you for your support, Matt, and we wish you all the very best in your new role. Thank you all again for coming this evening. We look forward to welcoming you to our next event. A recording of this event will be available on the Community United YouTube channel and website in a few days' time if you'd like to review it for yourselves or share it with other people. I would ask our speakers if you would mind staying on for a few minutes, if you will. And to all our attendees, thank you very much and a very good evening to you.
That's us.